examination. Yeah. So again, you'll be having the cotton-based neuropin hammer tuning fork, which is the 128. And you'll be doing the inspection properly from the front, from the back. That is really important. Then we go for the temperature, palpation temperature. We'll check the tenderness, we'll check the pulses, and we check the capillary refill time as well. Okay, so it's gonna be same thing, yeah. Then we have got the neurological examination. Neurological, again, you have got sensory examination, you have got motor examination. Sensory, same thing, you have got fine, you have got pain, you have got vibration, and you have got proprioception, joint position sense. And then you've got bulk, tone, power, and reflexes as well. Same thing, there is nothing differently that you need to do, right? Now, let's have a discussion on one of the scenario. I think then it will make life easy. So your FY2 in AN patient is Samaira, the age is 23, presented to the hospital after having an RTA, road traffic accident. She has come to the hospital complaining of pain in her neck. Talk to the patient, assess the patient, and discuss the management. Sometimes they will say, talk to the patient, do neck and upper limb examination and discuss the management with the patient. So that's your scenario, right? So first you start taking history from this patient. Let's see what are the questions that you're going to ask when you're taking history. So questions would be, how can I help you, doctor? I've got pain in my neck. Okay, pain in my neck. What I'm going to do, I will be doing my Socrates. Yeah. Tell me more, doctor. I've got pain here in this area. Okay, what happened is a few hours ago, last night, what happened, I was at one of the traffic signal. A car hit me from the back. So when you are stagnant, when you are on the traffic signal, somebody is hitting from you at the back, what's going to happen? This is what is going to happen. And I was okay after that. But then what happened is this morning, I started having pain in my neck. See, listen to me very carefully. When this pain started, pain didn't start soon after the accident. Pain started after a few hours of this accident. This is typical for something. This is typical for whiplash injury. Patient is stagnant and somebody is hitting you, and then you go ahead and then you go at the back. So this is what movement that can happen, and that can be the reason of whiplash injury. If the pain is starting soon after the accident, it could be fracture, it could be other things. But if the pain is starting after a few hours, it's going more towards whiplash injury. Yeah. So I'll be doing full Socrates, and remember one thing. When this patient says, I got road traffic accident, and I have got pain in my neck. When you get these two things, tell this patient one thing, that don't move your head and neck. This is very important. See, with the history, it looks like it is a whiplash injury, but I'm not 100% sure. So at this moment, I don't want to take the risk because I have to do the examination and all to confirm the things. So for the time being, tell the patient, don't move your head and neck. That's the thing. Now you continue taking history. You're done with the Socrates. Patient said the pain started after a few hours of this accident. Okay. I do the full Socrates as well. Pain is maybe 5 out of 10. It's a dull pain. Now, if there is any radiation or not, patient is saying, no, there is no radiation as well. Okay, makes sense. What else I should ask? Anything else? No, doctor. Sometimes patient says, yes, I've got neck stiffness as well. Okay, that's fine. What else you can ask after the road traffic accident, whether there was any injury, right? Any other trauma? Patient has got any nausea, vomiting, patient has got any headache, for example, right? All those questions you can ask. Now patient has got injury here, so you can ask if there's any problem in the upper limbs or not. What are the questions you can ask? Any numbness and tingling in upper limbs, in the arms? Yeah. You can ask about the power as well. I mean, if you're able to lift things properly or not, right? The power in the joint is okay or not. So, see, the task says do the neck and upper limb examination. I have to take history as well. I have to do the management as well. And I'm a human being, I'm not a machine. So the thing is, I have to do something in a way that I can do it in 8 minutes. So I may not have enough time to do the examinations. I'll do very specific examinations. So what I'm trying to do, I'm trying to ask these questions. When I'm asking these questions, whether there is numbness tingling, no doctor. Are you able to lift things? Yes, doctor. What does it mean? Upper limb neurological examination looks okay here, right? So that's why. So numbness, power, all those questions you have asked. What else we can ask? Uh, any other trauma, any other injury you can ask, and then past medical history, any neck problem, any previous surgery history that is there, you can ask. Now, what about lifestyle history, guys? Do you think it's important? Do you smoke? Alcohol, your diet, your physical activity, who cares? Who cares? So you don't need to be asking these questions. Skip that, right? Now what comes is the examination. So what examination you're going to do? First, I'm going to go for neck examination. Neck examination. So first you do the inspection. You do the inspection of the neck from the front, from the side, and you go at the back as well. Anytime you're going to the side or to the back of the patient, you do mention it to the patient that for the purpose of examination, I'm going to go to your side and to your back. Makes sense? And verbalize about the inspection. There is no redness, no swelling, no sign of an injury, trauma, no scar mark of any previous surgery. So all those things you can mention. Now what you're going to do is the palpation part. You can do the temperature as well. Just check the neck and compare it with the cheeks maybe, or compare it with the shoulder as well. Just see if there's any local rise of temperature in this area, right? Now, what you're going to do, you need to check the tenderness. First, you check the tenderness in the spinal area. If there is any tenderness in the spinal area, there might be something fracture, something serious. But mainly, you have to check after that paraspinal area as well. Check the tenderness in the spinal area, check the tenderness in the paraspinal area. That's the main thing. You may get tenderness in the left or right paraspinal area. That's the main thing. So that is the positive finding you might get. And that's your neck examination. Now, what you will be doing after this neck examination, you are supposed to do upper limb examination as well. Okay, so the thing is, as I said, you may not have enough time as well. So what you can do in terms of examination in this particular scenario, see, inspection that can be done very quickly. It won't be very time consuming. Palpation, I don't think so. I'll be needing this palpation. You can skip that as well. When it comes to the neurological, and you can start doing it, maybe you have done the fine touch, pain touch, whatever you do, it is normal. And what we have seen, examiner is helping the candidates here. When you're about to do fine touch, he's saying it's normal. No, pain touch, it's normal. So eventually he said, low upper limb examination is normal. So the thing is, you may not have to do the upper limb examination. Moreover, if I have less time, I can skip it as well. There's a reason I'm skipping it, because if you see in the history, if there's any numbness tingling, no doctor. Are you able to lift things? Yes, doctor. So what does it mean? There's nothing wrong in the upper limb. So you can skip that part as well. Mainly it's the neck examination that you are supposed to do. Now, upper limb is okay. In the neck, I got pain in the tenderness in the paraspinal area. Okay, now I have to do the neck movements as well. I have to do the neck movements as well. But you remember in the beginning, I told the patient not to move the head and neck. Do not move your head and neck. So now what I have to do, I have to send this patient for cervical X-ray. Cervical X-ray I have to send. And sometimes they say cervical X-ray is normal. When the cervical X-ray is normal, then only I can go for neck movements. Otherwise, don't even mention about it. Now, one more thing is happening in the exam. Sometimes what they do in this OSCE exams, you might find a line in the question. What says, what it's mentioning, that cervical X-ray is done and it's normal. If it says normal here, then perfectly fine. I don't need to be worried about it. And I don't even have to mention this patient in the beginning regarding don't move your head and neck, because it's normal. So I don't need to mention it. But if it is not there, I have to mention it. And once I'm done with the examination, I need to go for cervical X-ray as well. And if they say it's normal, then only I'll be able to go for neck movements. Now there are 6 neck movements that you should be doing. What are these neck movements? Number 1 is neck flexion. Then you go for neck extension. Then you have to tell the patient to look to your right side, look to your left side, touch your right ear with your right shoulder, touch your left ear with your left shoulder. These are the 6 movements that you need to do. And if patient has got whiplash injury, they won't be able to move that freely. What's going to happen? They'll be making some faces. So they will show some pain. So what you can say, my patient has got restricted neck movements, right? And what does it mean? It means your patient has got whiplash injury. That's it. Yeah, so there's a typical thing. In whiplash, am I going to get anything on the X-ray? Not really. It is a clinical finding. That is it, right? And what's the treatment? The treatment is number 1, keep your neck mobile. No, doctor, it's painful. I understand. I can see you are concerned. What we can do, we can give you some stronger painkillers. But the treatment is only keep your neck mobile. If you're not moving it, what's going to happen? It's going to become more stiff and it's going to be more painful. It's going to create more problems. So better is you keep it mobile. I know it can be painful, but we are here to help you. What we can give it to you, we can give you stronger painkillers. That's the main thing, right? And we can give stronger painkiller. And what else? We can refer you to the physiotherapist. We can do some physiotherapy sessions as well. And we can advise the patient for the ice compression as well. You can take a towel, wrap some ice in the towel and just put it on the neck as well. And for 10-15 minutes, do it a couple of times in a day. That will be much, much better. Don't put ice directly on the area. You have to wrap it in a towel and all. That would be much, much better, right? The patient will ask you one question. The question would be, please give me a neck collar. Are you going to give a neck collar to this patient? The answer is no, because neck collar is going to make things worse. It's going to make a neck more stiff. So it is contraindicated. The treatment of whiplash injury would be to keep the neck mobile, right? Later on, if the pain is severe, we might be giving some steroids as well, but that's rare. And the physiotherapy, that is something that you can do. And it might take a bit longer. It might take a few weeks, maybe a few months for the patient to get better with this pain. So it is time-consuming process, right? So that's how you're going to do. Can we do it in 8 minutes? Yes, of course, it is doable. But then if you're not doing unnecessary stuff, if you're going to the point, yes, it is definitely doable. So that's what I'm having in upper limb and whiplash examination. All right.